Hi, so tell me about yourself.
Hi, I'm Dr. Krithika Mohan. I'm a nephrologist and kidney transplant physician at Sidecare Hospitals, Bangalore.
So, what are 3 things that people generally don't know but should be aware of for good kidney health?
Okay, so many a times people don't even know what the kidneys do, right? So they know you have 2 kidneys, but nobody really knows what they do for you. All they think, every time somebody says kidneys, they only associate it with, making urine and right. So kidney has a lot of other functions too. Yes, one of it is yes, everybody knows that, is making urine, so getting rid of all the metabolic waste products from the body through urine. But it also has other functions in the body. One is to basically maintain a sense of balance or homeostasis in the body. So if your BP is high, it tries to lower it. If it is low, it tries to increase it. If you drink a lot of water, it tries to pee out the extra water. If you drink less water, it tries to conserve fluid in your body. It also maintains a balance of your electrolytes, your sodium, potassium, magnesium, calcium, phosphorus. So it indirectly maintains a good bone health. Apart from that, it also produces a hormone called as erythropoietin, which is required to produce hemoglobin in your body. So not many people know about all of these functions of the kidney. So if you have a kidney problem, all of these get affected, not just your urine or how much urine you make, or if you have swelling and things like that, but everything else also gets affected.
Okay. What are some early symptoms of kidney disease or kidney cancer?
So I'd like to say that kidney disease is it's a silent killer. So in the early stages, you may not have symptoms at all. Most of the times we pick up patients to have kidney disease on a routine annual checkup or a blood test, and they're asymptomatic. Many a times they have high blood pressures, and routinely they don't even get checked for their kidneys. They just get on with the BP medicines, and then they treat it like any other disease. So the earliest symptom would be, I think, especially in younger individuals, if they have hypertension, I would recommend getting your kidney screened. And other symptoms are very subtle, very non-specific. So let me give you an example. So if you have chest pain, you relate it to your heart, right? If you have breathing or cough, you relate it to your lungs. But we don't have a specific symptom like that for the kidney. They're very non-specific. You may have weakness, you may feel fatigue, you may have some swelling of your feet, you may notice bubbling in your urine or frothy urine, you may feel that you're peeing often, especially in the night, or you may have loss of appetite. They're very non-specific, so people don't associate these symptoms with kidney. So any symptoms of these can be associated with them, but nobody picks it up because they don't screen their kidneys. Yeah.
So, are there any, apart from screening, are there any other preventative measures that people could take?
So the other thing which I also want to talk about is how to look for kidney problems, right? So everybody knows about the blood test called as serum creatinine. So the normal range is usually less than 1.1. So if it's elevated, means that there's something happening in your kidneys. The second thing which everybody neglects, even doctors for that matter, right, like GPs and physicians, is a urine test. So urine test is very important to diagnose a kidney problem. So urine test can show you subtle indicators that there's something happening in your kidneys even before your creatinine levels go up. So they may be the early indicators, like you may be leaking blood in your urine, you may be leaking protein in your urine, which are all early symptoms or early signs of kidney disease. So that is something which I would like to tell everybody. Please check your urine at least once a year, right? It may sound very odd or absurd, but it can help pick up a lot of things. So that's something which I would like to tell everybody.
Okay. And finally, the three key things that you would like to say.
Okay. So 3 key things are, first, I want to tell you everybody in general should get an annual test. One is a blood test called as a serum creatinine. Second is a urine test. And if any of these are abnormal, I would suggest getting a scanning of your kidneys. And everybody else who's at risk. So you're at risk if you're over 60 years, if you have uncontrolled diabetes, if you have high blood pressures, if you have other conditions such as heart problems, liver problems, if you have frequent urine infections, and if you use a lot of over-the-counter painkillers, or if you're on alternative medicines, all of you are at risk of kidney disease. So I would probably recommend a more frequent screening in these patients, and at least once in 6 months. And if there's anything abnormal, to come and see a nephrologist.
Okay.
Yeah.
That's great. Thank you so much.
Thank you so much.